Hi, let's talk about the nerves of the orbit. There are a variety of cranial nerves which are serving the orbit and orbital region. To name a few, there is the optic nerve, Cranial Nerve 2. Cranial Nerve 2 is coming out of the brainstem and then goes through this optic chiasm, this cross here. And when it exits from that optic chiasm, it then enters in through the optic canal, just adjacent to the internal carotid artery. So here we're looking at a hemisected skull with the dura removed, and so we can see some of the nerves as they're traveling through the skull. The optic nerve is a sensory nerve, so it is afferent from the eye. So it's carrying visual information, special sensory information back from the eye. The other nerve that is very relevant here is cranial nerve number 3, the oculomotor nerve. The oculomotor nerve is exiting the brainstem here, so we can see them there and there. The oculomotor nerve, as its name would suggest, is predominantly a motor nerve to several of the extraocular muscles, levator palpebrae superioris, superior rectus, medial rectus, inferior rectus, inferior oblique are all innervated by the oculomotor nerve. The trochlear nerve is another motor nerve which is innervating extraocular muscles. So the trochlear nerve is kind of unique in how it exits the brainstem from the posterior aspect there and coming around. Sorry, I forgot to label. There's 3. That's oculomotor, and then there's 4. There's the trochlear nerve. The trochlear nerve is serving superior oblique, and we could remember that because the tendon for the superior oblique goes through the trochlea before it wraps around and inserts on the sclera of the eye. Then we have the trigeminal nerve. Trigeminal, the triplets there, cranial nerve number 5. And each division of the trigeminal nerve has a V number designation. So for instance, there is the ophthalmic division, V1, the maxillary division or nerve, V2, and the mandibular division or nerve, V3. Most of what will be relevant to this particular session will be V1. V2 is in the vicinity of the inferior orbit, and V3 is way far out, but we can see here's the splitting. There's V1 as it moves through the superior orbital fissure. Here is V2 through foramen rotundum, serving deep face. And then there is V3 heading out through foramen ovale to serve the mandible and surrounding areas. So the trigeminal nerve is actually a mixed nerve, so it's both sensory and motor. V1 and V2 are sensory divisions. V3 is both sensory and motor, so that's why the trigeminal nerve is mixed. And then finally, we have cranial nerve 6, the abducens. Oops, sorry, I should have showed you where 5 was here. 5 is there. The abducens abducts the eye. It innervates the lateral rectus muscle, and we can see 6 right there. So let me just label these on the brainstem for you. That's 2. That's 3. There's 4. Coming around, there's 5. And there are 6. Now we'll get into the finer details of some of these, especially the ophthalmic division of the trigeminal nerve as we move through. But keep these relationships from the brainstem and the skull in mind as we go. So let's keep these moving in linear order numerically. So we'll start with cranial nerve 2. So here are the cranial nerve 2s on the brainstem, just to remind you. And we can see here, this is a rather deep orbital dissection. The optic nerve traveling and would go through all of that. Through the optic canal of the sphenoid bone. And carrying all of that special sensory information back from the retina. Oculomotor nerve, cranial nerve 3. Again, let's just highlight that on the brainstem model there. Oculomotor nerve is heading in through the superior orbital fissure, and there is an upper or superior division, and then here's the inferior division of the oculomotor nerve. That superior division is innervating levator palpebrae superioris, superior rectus, and that inferior division is, the superior division is also innervating medial rectus. The inferior division is innervating inferior rectus and inferior oblique, and it also sends a branch to the ciliary ganglion. The ciliary ganglion is the parasympathetic ganglion, which is serving the eye. So it's specifically going to send short ciliary nerves to the eye, which we'll discuss at the end of this video. But oculomotor is a motor nerve, and it's also carrying preganglionic parasympathetic fibers to the ciliary ganglion. So it has a parasympathetic component as well. The trochlear nerve, cranial nerve 4, is coming off the brainstem there and there. We can see it most clearly just lateral to, this is the frontal nerve. Here is the trochlear nerve coming in, innervating superior oblique muscle. You can see there. There's a one-to-one relationship there. The trochlear nerve innervates one extraocular muscle, and that's superior oblique. Then we have V1. The story of V1 in the orbit is rather extensive. So here is 5 coming off of the brainstem before it divides into its divisions. The ophthalmic division is entirely sensory, again, which is very nice. And there are 3 branches to it. There's the lacrimal nerve, the frontal nerve, and the nasociliary nerve. The lacrimal nerve, as its name suggests, branches off early from V1 and travels through the superior orbital fissure out towards the lacrimal gland, which is located there. The lacrimal nerve is the smallest of the 3 branches of the ophthalmic nerve, and it is carrying afferent fibers from the lacrimal gland, the lateral portion of the superior palpebrae and superior conjunctiva. It also can transport via hitchhiking postganglionic parasympathetic fibers coming from the zygomaticotemporal branch of V2. So these fibers initially are the preganglionics supplied by the facial nerve, Cranial Nerve 7. Once they synapse in the pterygopalatine ganglion, they hitchhike via these V2 branches to either the gland directly or to the lacrimal nerve. They can get there either way. So we often say that there are communicating branches via the zygomatic nerve, but specifically it would be the zygomaticotemporal branch of V2. Now the frontal nerve is probably one of the more robust features that you're going to see in the orbit. Once we've removed the roof of the orbit, we can see this very large, very robust frontal nerve. The frontal nerve has two branches, so heading off medially here is the supratrochlear nerve, and then heading off lateral here is the supraorbital nerve. The supratrochlear nerve exits just above the trochlea. It's afferent from the medial forehead and palpebra and medial aspects of the conjunctiva. It's the smaller of the two. And then the supraorbital nerve has both a medial branch, which we can see there, medial, and a lateral branch, which we can see there. These medial and lateral branches will sometimes go through the supraorbital foramen or supraorbital notch of the skull, and they are afferent from the lateral forehead and lateral aspects of the palpebrae and conjunctiva, and are also afferent from the frontal sinus as well. So that's quite a bit of real estate there that's covered from the frontal nerve. You may recall these nerves when we were discussing the afferents of the face. So the V1 dermatome of the face is covered by these two nerves, the supratrochlear and supraorbital nerve from that session. And then there is the nasociliary nerve. Let's discuss that on its own because there are quite a few branches to discuss here. The nasociliary nerve, and I'll just circle everything here that we're discussing so that we can see the totality of nasociliary is quite a diverse part of V1. So starting kind of at the top of our list, we have long ciliary nerves that are of nasociliary. And we can see these heading to the eye, or from the eye directly. There are also some communicating branches from the long ciliary that are going to the ciliary ganglion, which is located there, which we'll discuss. The long ciliary nerves are conducting afferent fibers from the eye, both directly from the eye and via the ciliary ganglion as well. They also carry postganglionic sympathetic fibers from the superior cervical plexus, and these were being transported via the carotid plexus. These postganglionic sympathetic fibers are serving the dilator pupillae muscles. And so during a sympathetic response, your pupils then are going to dilate to let more light in, to have better visual acuity. In addition to those long ciliary nerves and their branches, we have a posterior ethmoidal, so that's the posterior ethmoidal, and an anterior ethmoidal, and then the continuation of this is the infratrochlear nerve. So the The posterior ethmoidals, which are those fibers, they are afferent from the sphenoidal sinus as well as the posterior air cells. So the posterior air cells combine with other air cells to form the ethmoidal sinus. So the posterior ethmoidal serves both sphenoidal and a part, the posterior part of the ethmoidal sinus, but specifically the posterior air cells. The anterior ethmoidal nerve, that is serving the nasal cavity. It's afferent from the nasal cavity, specifically the superior and anterior portions of the nasal cavity. That's something that we'll discuss in greater detail when we discuss the nasal cavity. And it's also afferent from the anterior ethmoidal air cells. And there's a branch of that that serves the external nose as well. And we'll talk specifically about those nerves again when we discuss the nasal cavity. They will come back. And then finally, the infratrochlear. Infra is below, so this nerve is exiting below the trochlea, and it is going to be afferent from the conjunctiva, specifically afferent from the inferior palpebra and portions of the lateral nose as well. So nasociliary really rounds out our discussion of V1. Next up, we have the abducens, cranial nerve 6. So we can see 6 heading out that way. 6 is going to the lateral rectus muscle, as we see there, and we can see 6 heading in to efferently serve the lateral rectus muscle. Abducens abducts the eye, so lateral rectus pulls the gaze laterally or abducts the gaze. So this was an exquisitely well-named nerve. Bravo. And then finally, we have the ciliary ganglion. The ciliary ganglion is a real treat to see in dissection. It's a tough one. Usually it's found lateral, sometimes a little inferior to the optic nerve. We could see the optic nerve is here. So there's 2. And then here is the ciliary ganglion. The ciliary ganglion communicates with the eye via short ciliary nerves, and we can see those short ciliary nerves there. And the story is complex. I have included this particular illustration at left, so if you're using this PowerPoint to make heads or tails, this is definitely something that will be discussed in the learning objective videos, but to see the importance of the ciliary ganglion and the innervation of the eye, conducting, they're not synapsing, but they're conducting through some of those general afferent fibers from nasociliary. The postganglionic parasympathetic fibers are originating there because they're synapsing from oculomotor nerve to serve the ciliary body and the sphincter pupillae muscles, so for accommodation of the eye and for making the pupils constrict during a parasympathetic response. It's also transmitting, although there's no synapse, for some postganglionic synaptic fibers that are coming from the internal carotid plexus and the sympathetic roots. So there are a lot of fibers that are heading, through this ganglion and being transmitted through these short ciliary nerves. There are some fibers that are directly innervating the eye, complements of these long ciliary nerves. So there are some sympathetics that serve the dilator pupillae, some afferents from the eye, specifically the cornea and adjacent regions, but most of the innervation of the eye is complements of those short ciliary nerves, and those are communicating through the ciliary ganglion. So we discussed quite a bit in this video. We talked about the locations and the roles of cranial nerve 2, which is optic, cranial nerve 3, oculomotor, cranial nerve 4, trochlea, cranial nerve 5, trigeminal, specifically V1, which is the ophthalmic division of trigeminal, and cranial nerve 6, which is abducens. Thank you very much for your time.